Tuberculosis is an infectious disease caused by a small germ known as Mycobacterium tuberculosis, which can affect all parts of the body. Most people suffer from tuberculosis affecting the lungs, and this is the most infectious form of the disease, which is spread from person to person. The Ghana Health Service, through the National TB Control Program, is partnering with the Concerned Health Education to train community volunteers as TB supporters to help in community TB outreach programs, thereby improving quality health delivery in the country. However, Project Coordinator for Right to Information Coalition believes healthcare can only improve when health workers are ready to give out information.
When you have access to information, you're able to know what the tax you pay, what the monies are used for. With information, you find that in terms of health, people are better able to take care of themselves. For example, somebody who has AIDS, HIV/AIDS, for example, and there's retroviral drugs for the person, and he or she is not aware. How can he access it? Now, if people with TB don't know that it's free, then how would they get treated? You live in a community, you don't even know the number of people who have tuberculosis. Then that means the sickness will keep on spreading. People will keep contracting it. So we're saying that it's good to have information, more information, constantly, regularly. At all times, we need information.
She further urged government to fast-track the Right to Information Bill.
Current Right to Information Bill that we have in Ghana, it's bad. It's bad because this bill, if it is passed in the current state in which it is, when you make a request for information, it will take you close to 6 months before that information is given to you. Now, when you request for an information in any institution and they refuse you the information, now you will have to appeal to the Supreme Court before that information is given. We're saying that how many people will go to the Supreme Court? Ghanaians, poor people, how would they have the resources to go to the Supreme Court? So again, we are concerned about the fees. If you look at the bill, even when you make a request, you're supposed to pay a deposit. And we're saying that why should we pay for the effort that the officer will take to search for information? The public officers, they hold information for our own good.
President of the Concerned Health Education, Isaac Ampoma, urged the general public to periodically go for tuberculosis and HIV/AIDS screening to prevent the resultant dangers associated with acquiring TB as well as its spread.
TB treatment is free, and for that matter, no one is to pay money for it, and this is being linked up with access to information. And once community members are equipped with information, we believe that the fight against TB would collectively be achieved, and therefore the fight against optimal healthcare is done collectively. The whole emphasis is to train these volunteers to go into the communities, to identify cases, bring them to the health system.
Currently, about 30 volunteers have been recruited and trained to embark on outreach programs such as contact tracing and stigma reduction of TB patients by identifying new cases and possible advice on referrals to the health centers. The project is under the support of the Global Fund to fight TB and HIV/AIDS in Ghana. Homogaji's report for Metro News.